A little bit about myself. I've been in healthcare over 30 years. I started when I was 2, which explains my youthful appearance, I'm sure. And my background is health information management. I currently work for the American Health Information Management Association, otherwise known as AHIMA, with the IG Advisors Group. I've been with AHIMA 2 years. Prior to that, I was with a large company healthcare system in Nashville called Ardent Health Services as VP of Health Information Management for 10 years. And my background has been really varied. I've had traditional HIM roles. I've been in the business office, worked in decision support, and I had a lot of opportunity to work in non-traditional roles with quality, case management, risk, et cetera. So I have a really exciting background and very happy to be able to do all of that. We're going to talk about information as it relates to healthcare innovation, and that I've heard trustworthy used several times during the past few days, trustworthy information or trust in our information. And trustworthy information supports the healthcare's success and strategic objectives for innovation. So I asked myself, what is innovation? What does that really mean? It sounds really grandiose, something huge that's going on within your organization. So I went to the dictionary, and according to Merriam-Webster, innovation is the introduction of something new, a new idea, method, or device. That's pretty simple, pretty straightforward. So it could be anything from a new system implementation, adding a new service to your healthcare organization, or something as simple as revamping a workflow, standardizing a process, or developing policies and procedures. So innovation can be anything that's going to move your organization forward. So I went out to the internet and thought, let me find out what is challenging for healthcare executives. What keeps a CEO awake at night? And I found this on Deloitte's website, and it is a survey of 20 healthcare system CEOs, and the 3 things that popped out as keeping them awake at night are integrating business vertically, triaging patients to the appropriate care setting, and reducing costs and inefficiencies. So I'm going to talk about each of these in the next 3 slides. So the first being integrating business vertically. What does that really mean? From a healthcare organization's perspective, it really means looking downstream at developing business partner relationships so that you can make sure that you have taken care of the patient from a continuum of care, that you can actually, once they leave your setting, that there's a place for them to go, that they are being taken care of. And some of the challenges with that really all focus around information from my perspective, delays in information, inaccuracy in information, the inability to share information because of lack of interoperability. And also, how are we engaging our consumers or our patients in their knowledge of these different care settings, the downstream care settings? And my parents are a case in point. Obviously, they're older. They're elderly patients. They live in a small rural town in South Alabama, and they don't understand what their care options are. They are constantly going to the physician's office or going to the hospital for various things, when there are things that could actually be done in their home or with the help of home health. So it's really engaging our patients to know what their options are and what they can do. Triaging patients, the real focus of this from this group of CEOs was ensuring that patients who end up at the emergency department truly need to be at the emergency department. And I'll tell you, I have been guilty myself of having a stomach ache or an earache or flu or something and going to the emergency department, being triaged and sitting there waiting because I'm not a top priority for them. Yes, I have an issue, but I'm not emergent or urgent type of situation. So that's really their focus, but I would add another component to this from my personal experience. And it has nothing to do with ED necessarily. It's really as patients are admitted to the hospital, is that physician order a correct order? Is it a clear order? Is it an order for the right treatment setting? And while we're not really triaging that patient like we would in the ED, we should be triaging that order to make sure that we are getting that patient to the right place. How many times have we all battled a patient that it says admit to observation. They're admitted as an inpatient when they really should be an observation, which is an outpatient setting for those of you who may not be as familiar. So it's things like that. And the gaps that we have there are just lack of standardized processes around registration. And I would add to that probably case management, et cetera, making sure that we do have people who are triaging those types of orders. Inability to move quickly. Without trustworthy information, we really can't make quick decisions about what we need to do with our patients. Poor quality of analytics, and of course that plays back into the data that we have, the information that we have for making those decisions, and then just need for better consumer engagement and education and enlightenment. The third one is reducing costs and inefficiencies, and I could probably spend a day harping on this one because one of my pet peeves is just being inefficient and redoing and reworking and right hand not knowing what the left hand is doing and all of those kinds of things. And healthcare is fraught with it. I'm sure, shake your head if you agree, that we just have so many inefficiencies because we aren't working in a collaborative manner. And some of those would be just lack of standardization, lack of data definitions that are pushed out to the entire organization, lack of workforce education and accountabilities, making sure they understand what they need to be doing, technology decisions that are made based on technology alone and not how we're going to use the information. And we're going to talk about all these in just a few minutes. And then a lack of accountability around operating as a single organization rather than business units, entities, departments, et cetera. We tend to work in silos in healthcare organizations, and I'm sure that's much like other organizations and industries as well. So let's talk a little bit about how we bridge the gaps. I'm going to show you the American Health Information Management, or AHIMA's Information Governance Adoption Model, or IGAM. So IGAM is another acronym you can file away in your head if you're in the healthcare sector. And what we did was look across healthcare organizations, not just hospitals, but we looked across physician practices, insurance companies, vendors that cater to or have services, products for healthcare organizations, and really compartmentalized all of the different places where information is used, their decisions about information, et cetera. And we call these the 10 competencies. Now, I'm not going to spend a lot of time going through each of these individually, but I am going to focus on about 5 or 6 of them that I think really play back into the whole discussion of healthcare innovation. But if you look at it, it's things like privacy and security, legal and regulatory, enterprise information management, et cetera. This does not just apply to the clinical information. We in healthcare tend to immediately think of clinical patient information. But we also have financial information, human resource information, contract information, et cetera. There's a lot of information that healthcare organizations have. And each of these actually do apply to all types of information and all healthcare organizations, like I mentioned, as well as whether it's electronic, paper, on a cloud, whatever, wherever it might be stored. So let's talk about strategic alignment. We just heard a little bit about that if you were in this last session about how information governance really needs to be aligned with the strategic goals and objectives of an organization. That's where that organization has stated very clearly, these are the things we want to accomplish for this year, next year, maybe 5 years out. And so our information governance efforts, our decisions about information really need to be aligned with those particular goals. This is the place where within the Information Governance Adoption Model, IGAM, you will find requirements, needed activities to talk about sharing of information, sharing of patient information appropriately to other caregivers, to other treatment settings, so that we can take care of those patients in the right place. Consumer-centric engagement is one that every healthcare organization really should be thinking about. How are you engaging your consumers, which are your patients? How are you enabling them to have access to their own information? I have 3 portals, and I go out. I don't look at them very often because they don't tell me anything. So part of the maturity within strategic alignment is to ensure that the information that we're sharing with our patients is something they really can use and understand, and that they can then take that with them and we can share it with their providers, et cetera. And then social media. How do we use social media to help us educate our consumers or patients, steer them in the right direction? The Facebook Workplace was a wonderful example of, how we can use that to further our business and also help engage our patients. Enterprise information management is what it really is from the beginning to the end. It's the life cycle of information. It's how we create it, generate it, use it, report on it, store it, and ultimately destroy it or disposition it somehow. And this is where we have everything around organization and classification, use of information, how we retain it, store it, end up deleting it. Patient identity management, which is one of the big components of this. For those of us in healthcare, if we don't get the patient's identity correct, there will be many, many risks associated with that patient's care, as well as increased cost in trying to duplicate testing and trying to actually undo and redo that type of thing. So that's where you find all of this, really the guidance around information itself. The next competency that I'd like to talk through is data governance. And this one's interesting because I hear people use the term data governance and information governance interchangeably. And I also hear people say, well, I've got data governance, I don't need information governance. And I personally disagree, AHIMA disagrees. We feel that data governance is a critical piece of information governance because data governance is really going to define how you manage your data, how you classify it, how you organize it, data, inventories, roles and responsibilities around data owners, data stewards, et cetera, so that we can have good data to make good information. Then the next one I'd like to talk through is IT governance. And IT governance is all about IT, your technology. And the technology is the backbone of any organization, and certainly a healthcare organization. Whether it's the clinical systems or it's the financial systems or our HR systems, et cetera, we have to have them. And I was in a session yesterday and I found it interesting. I can't remember the name of the session, but the individual said something about they'd been hearing that we really needed to back off of technology, that, we implemented all this technology and did it really make our lives more simpler. And from a clinical record perspective, I would say the paper record was probably easier to look at and understand, maybe not to access, because if I have it on my desk, you can't have it and you can't have it. But from a use perspective, from a physician and provider use perspective, it's probably easier. But we're never going to get back to that again. We're moving forward with technology. So this is where the technology decisions occur, but it doesn't mean that IT makes those decisions. And I've seen a bit of a turnaround in that over the past few years, where in the past IT made the decision based on the latest and greatest technology, or who was the best vendor, or who wined and dined us the best, whatever reasons we made those decisions. And then it would sort of bite us on the back end because the clinicians, the people who had actually used that technology, really didn't work as well for them. So now we have people at the table, the stakeholders at the table, to help make those decisions. So those decisions need to be a fit for that organization and for that area that it's supposed to support, be it clinical information or otherwise. And this is where we also address mobile devices and how we use those mobile devices for patient care and for other business needs within the healthcare organization, and also email as well. The next one's analytics, and I like to say this is where the magic happens. This is where we turn data into information. This should not be where we're having our analytics folks, our data scientists, our data analysts, et cetera, having to clean up data. And how often do we ask for something, and before we can get that, someone's got to go out and clean it up and figure out, well, what went wrong? And probably it went wrong because one group over here made a decision about what certain things meant. This group made a decision about what the same things meant, but different definitions, and therefore when all this data comes together, it doesn't really make sense. So information governance using this model really allows us to make sure that we are making collaborative, integrated decisions about data that then allows these folks to do what they're really hired to do, is to work with the business owners through the organization, be it physicians, be it senior leadership, and give them the information that they need so that we can make quick, agile decisions for patient care and for other business purposes. And then the last competency I want to mention is awareness and adherence. And I left this one in here to discuss because no matter how wonderful our information governance program might be, no matter how wonderful our policies and procedures might be or our workflows, if we have people, I'm going to call them rogues out there doing their own thing and not following these policies and these processes, we don't have information governance. So a key piece of information governance from a healthcare perspective, or really any industry perspective, is that the workforce has to be trained on their role and responsibility. That training will be very different for someone in housekeeping, someone in dietary, a nurse on the floor, someone in the business office, but that training is very role specific, related to their responsibilities for capturing and ensuring trustworthy information. So it's very role-based. They have their access to the policies. We monitor compliance with the policies and whatever they're supposed to be doing. The second piece of this, however, is consumer awareness. As a consumer, as a patient, I need to know what my rights are to my information and what my rights are to change my information if I feel it needs to be changed. So that's part of this particular competency as well. So with that, we've heard strategic asset. I've heard it several times during the course of the past 3 days, and information is a strategic asset. Now, I'll tell you, until I came to work for AHIMA 2 years ago, I knew information was important. I've been a health information management professional for about that 30 years plus, and I know it's important, but I never thought of it as an asset, like the equipment in our organizations, the buildings, our human resources, and it is, and we really have to think of it that way. We have to manage it like our other assets. You know, we have to make sure that we align it with our strategic goals and objectives, and that we govern it collaboratively and ensure that it is trustworthy by all of these oversight processes that we put into place. It's really a legal and ethical obligation of a healthcare organization to make sure that we have trustworthy information, because the first thing that would take care of are our patients. And who would want to go to a healthcare center, hospital, whatever, and go, well, I know the information's not good, but you know, I'm trusting that they're going to take care of me. None of us would do that at all. So we have to do that for our patients. So information governance is needed to ensure trustworthy information. Again, information governance from a healthcare perspective, much like any other industry, puts all of the protocols in place for making decisions about our information, be it data governance, enterprise information management, et cetera. And then that trustworthy information is the key to healthcare organization success through innovation, whatever that innovation may be. Again, it may be you're swapping out your some technology, your electronic health record, you're adding new services, you're merging with another organization, acquiring another organization, or something as simple as a record retention policy and procedure, which really isn't that simple if you think about it, not from a healthcare organization's perspective, but it really runs the gamut. You know, innovation could be any of those things. So we are in the patient care business, and it's interesting, and I probably should have stated this earlier, but it's really interesting. Healthcare is behind the 8 ball with information governance. Now, I've talked to other people in other industries, and they say, well, we're far behind. But I'll tell you, information governance is still something of a foreign concept to healthcare organizations. They know that they're doing things in the space, but they don't put the pieces together and say, but we need this oversight, we need this collaborative way of looking at it to ensure that we are all on the same page and we're looking at it from an organization perspective. So yes, we're in the patient care business. We are in the business to make money, be profitable, because that's what a business is all about, but patients are the center of what we do. So by having trustworthy information, we're going to be able to coordinate the cost-effective care for that patient, which meets one of the 3 things that keeps the CEOs awake at night. We'll be able to share our information more readily because we have all the protocols and processes and definitions in place for that. Ensure the patients are in the most appropriate treatment setting, because we have that information that we can look at real time to figure out where the patient needs to be, and retrospectively to find out where to have the patients gone and where did we go, where did we go wrong with that? How can we learn from that and fix that go forward? And then reduce the costs associated with ineffective processes, duplicate work. Again, I could spend a day on that, because right hand, left hand doesn't know what they're doing, and we have to constantly fix things on the back end. So with that, I'm not going to be able to make the Q&A. I've got a flight that I have to catch. Any questions that you guys might have for me, since we're kind of a couple minutes before time?
Not necessarily a question, but a statement. You did a real good job, and I think that you limit with attendance because everybody probably thought it was strictly geared towards healthcare. Mm-hmm. But what you said gears to all industries.
It does. It does.
And so maybe next time they do this for you, put healthcare in other organizations.
Right, right. That's a good point. That's a very good point.
You did a good job, and I'll be calling you soon.
Okay, sounds good. Well, that model that I showed you, we've actually been talking to other organizations, non-healthcare organizations, to share and tweak it a little bit. I mean, certainly there are, I think, 80 what we call maturity markers across all 10 of those competencies that talk about specific things about email usage and mobile device usage and record retention policies and all that kind of stuff. And there's some things that are very healthcare specific. There are even some things that some vendors would say, healthcare vendors would say, well, that doesn't really apply to me. So we've been working with other industries to see if it's something that they might want to adopt as well, because the principles are pretty much the same. The information governance principles, the 8 principles, are pretty much the same, and those 10 competencies are. Whether you're in manufacturing, you have, legal and regulatory that you have to deal with, privacy and security that you have to deal with. So, very good point, though. And I'll let Nick and Jim know that as well. Any questions? Other comments? Yes?
Why do you think it is that healthcare is, you said at the end that you felt like healthcare was pretty behind with information governance. Why do you think that is?
I think it's a hard concept for, I know, other industries, banking gets it, you would think, and with all the information that we have, patient information, financial information, et cetera, that we would be on the front end. Well, healthcare tends to be on the back end on some, not just this, other things. And I think it's because we know we're doing things in the space, but again, we're doing things, but we're not doing it the most efficiently, effectively, and we have to go back and redo so many times. You would think that just the sheer number of conference calls and meetings that you have to have to figure out what went wrong and let's figure out how to fix it, that in my mind would make me go, why aren't we doing something on the front end? And how can we do it better on the front end? And it's a real balance, though, because when we talk to HIM professionals and CEOs, et cetera, we do say, you guys are doing things in this space. You have compliance programs. You have record retention policies. Whether they follow them or not is another story. You have these things. You're doing QA on this, this, and this. But we have to be really careful also so they don't think, well, then we're doing information governance. We don't have to worry about it. So it's a balance to say, it's the carrot to say, well, you're already doing some of this. Now let's just pull you over the edge or over this line, and now let's blow it out to information governance versus, well, we're already doing it, so we don't need information governance. I really can't tell you. We spent all of last year just trying to make healthcare organizations aware of what it is and why it's important. And for some of us, even before I came to AHIMA, I actually started a program at my old organization, and I ran it for about 3 years before I left. The light bulb went off for me. I mean, I knew what it was and I knew why it was important, but it just doesn't for everyone. So I would.
I agree, because I work with Blue Cross in Tennessee, and you're right on point, especially the fact that we do data governance, but not information governance.
Right.
And so part of my responsibility is try to make sure we have the right people in the rooms at the right time. And 2, we do data governance and somewhat IG separately throughout our company,
Right.
but not collectively.
Right.
And so a lot of times they think, oh, we're doing this, we're good. No, show Scotty.
I was going to say, we do it in silos, like you said.
Yeah.
We have a compliance piece, we have an HIM piece, we have an IT space, but information governance is all of it, bringing it together, where all of us can do the same information, we're not redoing stuff.
Right, exactly.
Maybe it's because like a health center sees itself as completely separate from the accounting department, right? I mean, there's something about healthcare where
The clinical side versus.
it's so siloed.
And that's what when people start, my old organization, we were focused on clinical information. I had on my list, on the agenda, things we need to start thinking about, HR, contracts, et cetera, finance, et cetera, but we never got there in that 3 years. We were still focused on clinical because there were so many opportunities in the clinical area that we just never moved past that. But I think that may be part of it. Okay, well, yes.
I think finance is so heavily, and healthcare I know is as well, but finance is so heavily regulated by the federal government. I think it almost gives them, it makes it easier for them to innovate sometimes because they've got this framework in place that's so much stronger than so many other industries. They're not guessing as much as some of the
Right,
others as to what
right.
they can do or what they have to worry
Right, and the clinical side of things was with the technology. I mean, I had a conversation with a physician. He's a wonderful physician at my old organization, very supportive of technology and cutting edge things, and supported our coding efforts and our clinical documentation improvement efforts. He called me one day and said, Ann, I just need to vent, just for a couple minutes. Well, a couple minutes turned out to be an hour. With this doctor, he was so frustrated with the electronic health record because he said he couldn't put the pieces together. Like when you thumb through your folder of patient information, you go, oh, here's this and here's this. It's screens and screens and screens, and you go from 10 pages of paper orders to 100 screens of orders, and they couldn't find anything, et cetera. He was very frustrated, very supportive of moving forward with whatever, but very frustrated with it, and felt like it wasn't in the best interest of the patient, which I see his point. So the clinical piece of it, as opposed to the financial piece, is also very difficult, too, because you want to streamline it. You have to have that paper trail. You have to know how many times someone's touched an order, but do we have to see that in the orders? Because that's what we were seeing. The original order, the nurse took off the order was revised, which you would have to see, and it was completed, and all this stuff, it made an order every time you touched it. So there was, like, for one order, you had 6 or 8 entries. So it, tripled or more the pages of orders. So it's that sort of thing. So it's a protection thing, but it's also, how do you make it easy for physicians to really be able to take care of their patients, because that's what they want to do. So, well, thank you all for coming. I appreciate it.